Dr. Mohammad is the Supervisor of Foreign Affairs, Loans and Grants in Egypt. Egypt has made a lot of strides recently with hepatitis and a scheme of insurance all over the country. Welcome to our program.
Thank you.
Dr. Gad, the scheme for insurance, we're talking here about health for all, by all.
Yes.
In order to reach everybody, Egypt is a very big country with 100 million people. How is the ministry's plan to reach all these people with an insurance scheme?
Okay. Our project is to cover all the health needs in Egypt, and starting from the entry point, which will be the primary healthcare centers, which will be managed and run by family physicians.
All right.
And very well trained family physicians according to the international standards. Okay. Also, we are adopting a new system for referral system for
in case they
this
need.
project, yes, for referral system for the higher levels for care to the secondary and tertiary health care. So we will start in this phase to implement the universal health coverage for the Egyptian people, starting from the Port Said governorate.
So you'll start in one governorate, or how many governorates are you going to be starting in?
We will start by 7 governorates.
7 out of the 20?
Yes, the first one, which will be launched at the level of the primary health care, will be in
Port Said.
Yes, Port Said in next December.
All
we will
right.
start by 17 primary health care units.
Okay.
And the total number of these primary health cares, they are 35.
All right.
And only in Port Said health care. The real running for the integrated system,
all right,
in Port Said will be launched by the 1st of May 2019.
Great.
This
so
is
you're,
like
you're going to test it, sort of, see
yes,
how it
it
works.
will be like a pilot, and it will be like to be evaluated
okay.
for the pros and cons, which we will face by implementing the new system.
And you chose Port Said because it's a rather small one and manageable first to start.
Yes, yes. And we started by developing or improving the all the facilities, all the hospitals, and the infrastructure, renovations, and the new buildings.
So the actual structure, and you've trained the physicians as well.
Yes, infrastructures, including the buildings and the equipment, and all the essential updated equipments we are already starting to fix in these facilities.
My question here is, to do a project like this, it's a huge endeavor.
Yes.
You're starting in one governorate, and there are 26 governorates, right?
Yes.
So it means you're going to project a very huge budget to be needs to be allocated.
Yes.
So it needs the highest political will. It is there from the presidency itself to let this program move forward?
Maybe it was, the initiation was just with Port Said, okay, and South and North Sinai. But we have a parallel project, which is the model hospitals, which were only 29 hospitals.
Okay.
It's like specialized hospitals scattered all over the country.
All right.
To just to facilitate the referral for specialized hospitals with secondary and tertiary care.
And you ensured that they were spread all over, so people don't need to travel.
Yes, and now with this promising project, we increased the number of hospitals to be 49 hospitals, right, including the whole constructing
everything
projects,
was there.
and yes. And all the manpower with new standards and new concept for quality and patient safety. So this project will facilitate and speed up the implementation for our project for universal health coverage.
Dr. Gad, cooperation is very important.
Yes.
I mean, no country can do it completely on their own.
Yes.
So has there been buy-in from other international agencies, assistance to be given once the project was launched?
Let me tell you that WHO is the main partner in our visions in all levels of healthcare. But in this project, essentially, we are always assisted by the capacity building and the technical support from the WHO. WHO is always the main player for
It's
our
good to know.
country.
It's good to
Yes.
know.
And also other UN daughters like UNICEF also are supporting at the level of primary health care. But always the country office of WHO is always supporting.
There, because it's
yes.
within the ministry
Yes,
itself.
because we are on
In the
daily,
same daily basis in
yes,
contact.
daily.
Thank you very
activities.
much, Dr.
You're
Gad,
welcome.
and I'd like
Thank
to
you.
congratulate you and
Thank
wish you
you.
all the best.
Thank you. Thank you
Health
very
for
much.
all, by all.